Hi guys, welcome to another episode of Living Life, a Life View. I am your host, Dr. Veronica Garcia, and today I am joined by a super cool member of the institution. She is an associate professor for the chiropractic program. Dr. Lu, welcome. How are you?
Oh, thank you for having me here.
Absolutely.
I'm good.
It's an honor to have you here.
I appreciate the opportunity to chat with you.
Absolutely.
Okay.
Dr. Lu, tell me a little bit about what classes are you teaching right now in the doctorate program?
So right now I'm teaching all the microbiology classes. So first class, students typically take in the quarter 3, it's bacteriology, virology. We have lecture in the lab. And then second class, parasitology and mycology, right? And then third class is immunology and the disease patterns.
Gotcha.
So all these 3 classes will be in the microbiology section, and students are going to take the part 1 board. So that's part of part 1 board course.
Exactly. So
Yeah.
there is a whole section in part 1 boards, which
Yeah.
is, so for those who don't know, a doctor of chiropractic, we take 4 board exams and the PT if you're
Yes,
depending.
yes.
But the part 1 board, usually we take it at the end of year 1. Year and a half?
Typically, they encourage students to take it at quarter 6, quarter 7. So at that point, they should take all the basic science courses. So we are part of basic science.
So as you're
Yeah.
accomplishing the requirements, you're also going in and taking the exam, the part
Yes,
1 board.
part 1 board. Once you pass the part 1 board, you can move on to part 2, 3, 4. After that, you get your license, and then you can become a doctor. Or chiropractor. Yeah.
I love it. I love it.
Yes.
Tell me a little bit about Dr. Lu. Tell me a little bit about your PhD and who is she?
Okay, so I get my PhD at the University of Florida. So I studied how the microorganisms help to clean the wastewater. So the wastewater treatment process. So the lab I worked with also doing the water quality control for the EPA.
Okay.
So I did an experiment with bacteria, with virus. So that was fun. And also I did a teaching assistant as I pursued a PhD degree. So I discovered I like teaching and research. So so they laid the groundwork, right?
Yeah.
For later on, I switched from research to teaching now.
That's amazing. And what led you into studying microbiology?
I grew up in the rural area of China. So I like to just during childhood, we don't have a lot of video game or any phone or anything, right? I like just wandering out in the backyard and the mountain, just to observe the wildlife. I love the nature.
Yeah.
So then when I was in high school, taking a biology class, I discovered this whole living creature under a microscope. So I said, I want to know them. So I majored in microbiology in the college.
Yeah. Wow. And did you go straight from China to Florida?
Yes, from China to Florida.
That's awesome.
Yes, and then from Florida to Atlanta.
So what brought you to Life University? What about Life University made you come in here and start teaching?
I joined Life University in 2016, and previously I already taught in Georgia State University, Georgia Gwinnett College. So I'm mainly teaching undergrad, general biology class, human anatomy, physiology, and some microbiology, public health class for the student in the pre-health program. So the Life University, I started as part-time actually. So when my kids was little, right? Trying to achieve the life and work balance, right? So I like the healthcare, taking care of patients in a holistic way. That's I do agree, right? Like you want to see, so all the organ system, they interconnect, communicating, right? So you want to manage or preventing the disease occurrence in a holistic, long-term, holistic way. So, and also I love our beautiful campus. How about that?
Yeah. It's a breathtaking campus.
Yeah, it's beautiful.
I love every season. I love that we get to have these open, giant spaces campus for students to just relax and connect.
Yeah, it's beautiful
but
campus.
Walking trail.
Yeah, trail. Yeah, yes.
So nice. I was walking the trail this weekend.
Oh,
it was
nice.
So nice. We brought our dog and whatnot, and we took pictures and just
I love hiking.
Back.
I still love hiking. I still like to go to nature, but I also like to study the microscopic living things. So, yeah.
Tell me a little bit about what are some of those, reasons why it's so important for us as healthcare providers and chiropractors to study microbiology.
Yes, because some microorganisms cause disease as acute form. So acute disease, hyperacute, the patient have to go to hospital, emergency room for that. But however, a lot of microbial infection, even cancer, right? It's a cause. It's either chronic or latent, right? Or sometimes the bacterial, virus, worms cause cancer. So this is due to the long-term patient's lifestyle, right? The choices. So if we manage the microbial infection, especially the chronic way or the disease due to lifestyle, that's where the alternative holistic approach, then we can prevent maybe the serious complication associated with microbial infection.
Exactly.
Yeah. For example, nowadays we have this Lyme disease on the rise in U.S., right? So if you look at the patient have towards the later systemic phase, you have arthritis, right, meningitis, endocarditis. So it's a serious complication. It's hard to treat. However, this bacterial infection, tick-borne bacterial infection, if you treat the disease early, like the bow eyes rash, where the tick bite, at that stage, you just take the antibacterial antibiotics, you eradicate it, you get cured. You don't have to worry about the complication. Yeah. So that's why. And also, you can imagine the patient dealing with chronic condition, chronic inflammation, even fighting cancer, or the chronic microbial infection. So if you have chiropractic doctor come in and help them, right, they don't have to take as many of potential medication, right? A lot of medication have serious side effect, right? So you can really help the patient have better quality life.
And enjoy.
Yeah, enjoy the life. Yes.
Yeah, it's all about the root cause. And I think it's such a beautiful conversation to be able to educate our patients. And
I know.
Hey, I also understand this piece. I might not be an expert on it, but I understand it so that I can guide you.
Yes, right? Because nowadays, all the healthcare is really highly specialized. Right? So the chiropractic doctor could be part of team, right? Help the patient for long-term healthy lifestyle, long-term manage the disease so that we reduce the need to taking the pain medication, taking the potential medication with serious side effect, and prevent serious complications associated with this microbial infection.
I love that. I love that the idea of just bringing chiropractic as part of the team.
You got to be a team player because you look at the traditional medicine. Every doctor is highly specialized. They are already part of a team anyway, right? They need to recruit, or a chiropractic doctor need to be part of that team together. So,
and we get to bring that holistic side. We get to bring the conversation of not just treating the symptom, but let's look for the root cause.
Yeah, because we are all the organ systems in our body, we're talking to each other, right? You have to manage it in a holistic, long-term preventive.
Yeah.
That will save the healthcare cost too.
Exactly.
Yeah.
Exactly. That's a huge conversation. Healthcare's dollars are so high. But when we're able to address it in a holistic, more complete way.
So it's good to have option with somebody in the acute, hyperacute. They do have this emergency room.
Of course.
Hospital helps them. But we want to prevent to get there, right? So you can. I
love that. I love that. What would be, some advice for those students that are getting ready for taking that Part 1 board that they have to study for microbiology, and the microbiology includes all of the bacteriology and the
virology,
and the virology and the parasitology.
Yes.
What would be a piece of advice as they're getting ready to take that Part 1 board section?
when we teach the microbiology course, we kind of look at the microorganism in the group based on the structure. So this is bacteriology, virology, the structure, what they cause, how do they resist host immune system, this, that, right? And parasitology, mycology. Again, we break down. So when you're taking the board exam, you're going to look at as this is opportunity to integrate everything in there. So you can put all that microorganism in terms of organ system. So for example, which group of microorganisms, which bacteria, which virus, which parasite, which the worms, in fact, nervous system. So you can group them, and then you can integrate that into anatomy class, physiology class, right? And then you study the respiratory tract. You learn the anatomy of respiratory system. Then you say, hey, which bacteria, virus, parasite, the worms infect the respiratory system. You can make the story. When you connecting them, making story, guess what? It's easy.
When we stop trying to memorize them.
You don't want to look at, you don't want to look at it as just separate the dry fact, like just piece of information. Oh, this is a bunch of words, mostly Latin words. Like remember them, right? That's, have so many of them. So you can like really mix them up.
I love that idea.
But if you look at just you put everything in terms of human body, organ system, and then you connect the microbiology with the anatomy, physiology, with immunology, right? And then guess what? With pathology, then everything integrate so that part one exam won't be too hard or too dry. You can have fun with it.
So you start becoming a doctor.
Then that you're on the way to doctor, right? Become a reactor doctor. Yes.
That's beautiful. That's so cool. Oh my gosh, I love it. Thank you so much.
Thank
you for the piece of advice for the students. Thank you for being here and teaching and being so passionate about it.
I enjoy it. Our students, they are the best. I like talking to them. They choose, they are passionate about their career choice. They really want to learn it, right? And they are very mature. So I enjoy have conversation with them.
That's awesome.
Really.
Well, thank you so much, Dr.
You're
Lu, for spending some time with us. Thank you for being at Life University.
This is a beautiful studio here.
Well, have a good rest of your quarter. Have an amazing time with the students teaching and learning and everything in between. And we hope to continue seeing you around.
I hope you have a good day too.
Thank you. Thank you. And we'll see you guys on the next episode of Living Life, a Life View. Bye.
Okay, bye.